All right. Hi, everyone. I'm Kevin Kunzman, Managing Editor of ACP Live and Contagion Live, joined today by ACP Live ad board member, Dr. Brad Glick, who's stationed in Miami, Florida right now at his practice. Dr. Glick, first off, how are you doing?
I'm doing okay. As you can see, I'm sorry I'm not in a very nice suit like you, but I'm in the trenches today. I did work today and saw some patients. This is our first week back, but it's very scattered with patients right now.
Yeah. And of course, totally understandable and actually pretty prevalent to what we want to talk about first and foremost before we get into some of these topics and questions left over from our webinar last week. It sounds like from what you said before we jumped on was that your practice is looking to regain a little bit of normalcy starting next week. What exactly has derm practice been like for you during COVID?
Well, for the last month and a half, we've been seeing essential dermatology, so mostly emergencies, rapidly growing skin cancers, really bad rashes. I have a slew of patients that have some pretty severe rashes. They're on biologic therapies, pretty aggressive systemic therapies, and some of them we actually just had to see in the office if they were breaking through, how to treat them aggressively, systemic antibiotics, and maybe reinitiating new biologic therapies were apropos. Most of the patients that are already on stable doses of various medicines like biologics, we've been able to continue and have done so happily as long as they're well and not having any active infections in general, and certainly no signs of COVID-19. As we talked about during the webinar, there are recommendations from the American Academy of Dermatology and the National Psoriasis Foundation and other bodies that govern dermatology where patients are stable and they're doing well. You keep them on drug. New starts are controversial. So that's what practices look like, mostly really dermatology emergencies. And moving forward to next week, more than likely we will start seeing some of the acne follow-ups, although a lot of this, Kevin, we've been doing by telemedicine, which has become very important for our practice in this last month plus. Some of our psoriasis follow-ups that need to be seen in the office and some of the patients with more severe conditions that really couldn't come in. And I think mostly this next couple of weeks, we've got to kind of get our patients back in and get some of the procedures that they needed to get done, surgeries on dysplastic nevi, various skin cancers, even some of the melanoma in situs that we had not completed. And even if we wanted to, some of the patients really didn't want to come in. So that's what it's kind of looking like in the next 2 weeks. And then hopefully I'm thinking by June, if everyone stays safe, we wear our protective gear. Of course, we're all going to be masked. I showed you before, I have my my handy shield here that I'm going to be using. We're going to be wearing some appropriate beading gowns that will protect us from any kind of materials that may hit us, although that's controversy as whether it's necessary in dermatology. And obviously gloving up big time all around, being as hygienic as we can throughout the entire office. One of my colleagues who was on a WebEx the other night talked about leaving doors ajar so we can move the door so we don't have to keep touching the handles. We have to be very careful about some of those things, evidently. And we'll play it out. We'll really hope for the best that our patients are safe and we are safe. All of our patients are coming into the office with masks on. We've requested that. They want to come gloved. That's up to them as well, too. And that's the new normal.
Yeah. And I was going to ask too, I mean, obviously a big stressor right now is, managing prioritized cases versus elective cases, particularly in dermatology. Are you guys at a point where maybe you're looking, particularly in your practice, at I guess, a break point where, the decision needs to be made that some of these elective procedures are now possible to proceed with? Obviously, you reference AAD's guidance, and obviously we have a lot of great authority guidance right now on how to go about it. What exactly are you guys using as your metric for when that can be reintroduced?
Well, I think the correct answer, if there are correct answers here, because there's a lot of uncharted territories, you have to follow your state regulations. So we were really not able to see non-essential dermatology do a laser, and for that matter, aesthetic procedures. Now, my practice, it's already Wednesday this week, midweek. We haven't done any cosmetic procedures in my clinic. We will start some of those procedures next week. If someone wants Botox or fillers, from what our guidance is, we can do those things. I believe some spa services have still been kind of put off to the side for right now. At least in our clinics, we're not going to be doing facials right now. nothing that really involves too much mechanical procedure on the face. Some of us have talked about maybe not even doing fillers around lips, for instance, because you would be taking masks off. It's very tricky, Kevin. There are a lot of variable optics, and I do believe, as you ask in your question, and there are going to be some challenges that we face in our decision-making trees. Some of it's going to be on our side of the fence, and some of it's going to be some of the patient concerns. I will share with you that we have them signing a document that we feel is appropriate, just so it's not a consent, that they just understand that we're seeing them during the course of the pandemic, and there are many unknowns here. We are keeping up our end of the bargain and being as hygienically appropriate, following CDC guidelines, following the recommendations of the American Academy of Dermatology, and we ask for them to have some understanding and also responsibility on their side of the fence as well. And we'll really all do the best we can, because really none of us have experienced this ever before.
No, and exactly that. I mean, there's no evidence to build this off of. We're kind of setting the precedent for, forbid anything like this happens again. And I think that's why there's a particular stress being put on specialties like dermatology, where you do have chronic disease patients that are, one, at more severe risk of severe disease if they contract it, and two, a psychological burden that accompanies their disease. It's a very delicate process already, I'm sure. Add this to it. It's not an enviable position to be one of these patients right now. So
I think, Kevin, one of the biggest challenges is going to be for our surgical colleagues. I mean, I do surgical procedures as well, but pretty much all of our micrographic surgery, Mohs surgery, is done on the head and neck. But, our Mohs surgeons are pretty used to wearing shields, as I just showed you. They're used to being masked up. A lot of the procedures we do in dermatology, we haven't been as quite aggressively garbed up, if you will, in gowns and masks and shields to do a simple biopsy. And of course now we're going to be a little bit more aggressive on that medical and dermatologic surgery side. But our Mohs surgery side, they're pretty used to being that aggressive in their preparation. So we'll navigate through it as carefully and as safely as we can, both for our patients and also for ourselves and our staff.